Abdominoplasty is an operation performed to remove and tighten up, to remove some of the skin of the abdomen and tighten up the skin of the abdomen. In my judgment, I think in almost all cases it's best done when patients are at or close to their ideal body mass or weight. It's tempting to think that abdominoplasty is a fat reduction operation, but I don't think it's best done under those circumstances. I don't think it's, if someone is overweight, that it's an operation that's as safe or as effective as it would be if they were at their more ideal weight. So I'm somewhat conservative about how I advise patients about having surgical procedures like this. But if I see someone who's overweight, I strongly encourage them to lose weight in an effort to prepare themselves and to prepare the surgery to be as safe and as effective as it can be. In most cases, it's done after pregnancy, when the skin has been stretched out, and there are a lot of stretch marks that are left behind. These are some of the ravages of motherhood that occur. But it's also done in other weight loss situations when people have lost weight on their own, or sometimes some bariatric surgery. They have a lot of skin and that is not going to go away, and it can best be dealt with by removing the skin. The operation of abdominoplasty is a major surgical procedure with risks that are very significant, and so patients need to know as much as possible about the pros and cons of the surgery itself and the things that can occur. It's usually done as a surgical procedure as an outpatient with overnight admission, and the reason for the overnight admission is because the drains left in place. There can be significant discomfort that require pain medication delivered either by IV or by intravenously or by intramuscularly or by shot. And so in most cases we perform it with that short time overnight hospitalization. The operations often are done in facilities where if you stay in the facility less than 24 hours, it's considered still an outpatient procedure. So the place in our office that we perform these are one of the outpatient surgery facilities that have that capability. But the other aspect of this operation is that besides taking out the skin, we sometimes repair the muscles that have been displaced somewhat to the side, and we don't actually do anything to the muscle itself other than bring the muscle closer together so it'll function more in a better way, and it tightens up the abdomen in a slightly different direction, somewhat different direction. The operation takes usually around 2 to 3 hours, and again we have to watch patient for the various complications that can occur with any surgery, including things like excessive bleeding or infection, and we have to tell patients in advance things like that can happen under any circumstances. And the most important thing about having surgery of any type, including this, is that if complications do occur, that they are recognized and dealt with appropriately. And I'd rather tell patients about things that could occur and have it not happen than have them be surprised by something that happened that they were not aware could happen. The patients are limited in their activities usually for anywhere from 3 to 6 weeks after the surgery. I like to tell patients, and especially women who have been through either cesarean section or major abdominal operations, that this operation of abdominoplasty fits into that category of type of operations in terms of what it involves for them, and the recovery aspects of it. So it's a great operation. It deals with basically the only way that you can deal with circumstances where there's a lot of excessive skin. But it's an operation that has to be planned for, and patients have to fully understand what they're getting into. It's one of the more frequent things that we do as plastic surgeons, and it's most people happy with it or glad they did it. And occasionally you'll have someone that, as with any surgery, will say, if I knew then what I know now, I wouldn't have done that. But I think it's less likely to happen if a patient, again, knows all the pros and cons of the surgery before going ahead with it. We have in our office 3 board-certified plastic surgeons, myself, Dr. David Bowers, and Dr. Krista Fender, who would be more than happy to see you and talk to you as a patient about what's involved in this surgery and examine you and try to tell you what your circumstances are and whether you would be a reasonable candidate for having this surgery, which is, I think, the best information a patient can get is to help them decide whether to do this or not.